Hello y'all, my name is Tara Garano and today I have some information to share with you about cardiac arrest. So cardiac arrest is an electrical problem in the heart. The heart is a self-exciting tissue, which means that unlike the other organs in your body, it doesn't rely on nerve impulses. It relies on its own electrical stimulator, which is the sinus nodes. And when the sinus nodes are acting up, they're not going to send those electrical pulses for the heart to beat and contract in a normal rhythm. So what will happen is you'll have arrhythmias, and the most common one that causes cardiac arrest is going to be VFib, or ventricular fibrillation. So normally, your heart contracts, it squeezes at a normal pace, and it pumps the blood out. When you're in VFib, your heart's going to start like quivering, so therefore it's not getting the blood out, it's just kind of staying in there, and eventually your heart will stop beating and you will die if you don't get help. A lot of people mistake it with a heart attack. It's not a heart attack. You can look at it as an electrical versus a plumbing problem. Like I already said, the cardiac arrest is going to be more of an electrical problem, where a heart attack is a plumbing problem. Something's blocking the blood's not getting to the heart, which is what's going to cause the heart to die off. So I have a video to show y'all what ventricular fibrillation looks like. So you see the heart's just quivering instead of like beating, so it's not getting any blood out. And eventually, if you do not have help, it will just stop beating and you will die. So, I forgot what I was saying. Okay, the risk that it can happen to anybody. Like, you don't necessarily know it's going to happen. Most of the time when it happens, you just fall out. The way you're going to diagnose it is going to be you don't have a pulse, you're not breathing, sudden collapse. It's not something that you see coming most of the time. There are a few risk factors that can kind of let you know that, this could happen to you. If you have a history of it in your family, if you've already had cardiac arrest or heart attacks before, if you have uncontrolled hypertension, high cholesterol, obesity, diabetes, and you use a lot of alcohol, if you do illegal street drugs, if you smoke, of course, that's a risk factor for everything. And it's most common in males, and hypokalemia, which is low potassium, can cause it, and low magnesium can also cause it. It's not only caused by VFib. It could be caused if you got struck in the chest or some kind of trauma like that, or if you got electrocuted in your heart, it could throw the rhythm off. Basically anything that can throw off that electrical rhythm. And as far as treatments, you're not going to be able to take any medicine to stop it. The only way that you can stop it is defibrillation, which stops the fibrillation. So basically, if somebody falls out on the floor, you've got to start CPR on them. And CPR alone isn't going to help them. That's kind of the difference between a heart attack. Also, like with a heart attack, you can do CPR on somebody. With cardiac arrest, you're going to have to do CPR until somebody gets there with the AED, the automatic external defibrillator device, or till the ambulance gets there and can shock that heart back in rhythm, because that shock is the only thing that's going to stop the quivering and put it back to where it needs to be. If you don't get help within 4 to 6 minutes, brain damage starts to occur, because your brain, unlike your other organs, does not have a reserve oxygen supply, so immediately it's going to start dying off. So you got a short window of time, and most people have more likely chances of survival if the AED is used within the first 4 minutes. So the survival rate of people that do get treatment is only 8%. So it's just something that you got to hope that there's somebody around that knows how to do CPR, which, let me find this little, 326,000 people per year experience cardiac arrest outside the hospital setting. So that's at home, at work, and they just got to hope that somebody's there that knows what to do and that there's an AED nearby, or somebody can get there fast enough with one. In addition to that, there's 209,000 that occur in the hospital settings, which are a little bit more controllable. So basically what that leaves me at is it's really important that if you see somebody fall out, you do start CPR immediately, because like I said, you have a short window of time, and when you're doing CPR on somebody, you need to make sure that you're putting the heel of your hand in the center of their chest, normally between the nipple lines, and press hard and fast, 100 beats per minute. When you're on your knees, you don't want to like try to rock into it. You need to make sure you're using your elbows. People sometimes are scared, I'm going to hurt them. Well, you think they're going to wake up and be mad because you saved their life, but you broke their ribs, you know what I mean? They're probably going to be thankful either way. And when they get the AED device, you'll hook that up and it'll tell you when to shot them. And like I said, that's the only thing that's going to put them back in a normal rhythm. And I have a little video to help you remember how to do effective CPR.
Sudden cardiac arrest is the third leading cause of death in the United States. If recognized and treated early with hands-only CPR, the chances for a loved one's survival greatly improve. If you see a teen or an adult suddenly collapse, it's important to act fast.
Oh my gosh, are you okay? Are you okay?
Helping to save a life is easier than you might think. Step number 1, have someone near you call 911 or call 911 yourself.
Somebody call 911.
Step number 2, get directly over the victim, put the heel of one hand in the center of the chest, and put the other hand on top of the first. Then, push hard and fast in the center of the chest until help arrives. It's important to push at a rate of 100 beats per minute, which is the same tempo as the song Staying Alive.
Okay. So that's a little song for y'all if y'all ever do have to do CPR on anybody in cardiac arrest or anything to help you do 100 beats per minute is Staying Alive. And one thing I forgot to mention is that there's not usually any warning signs. Sometimes you may have shortness of breath, chest pain, or vomiting, but most of the time you're just going to fall out. So that is all I have for you today.